The vast majority of our speech therapy patients with ALS will develop dysphagia, and the dysphagia can be so severe that the safest way to get nutrition and hydration is through a feeding tube. In this video, you'll learn when to recommend a feeding tube, who to refer out to, and what to say to your patient when talking about this big topic. While every ALS patient is different, your patient may need a feeding tube if they're at a high risk of aspiration or aspiration pneumonia. Oral intake decreases due to fatigue or their dysphagia, and their dysphagia is so significant that it causes distress during meals, like choking episodes or difficulty breathing. They experience significant weight loss due to not eating enough, and or they have reduced respiratory function. They have some sort of difficulty breathing. While we aren't the ones who can actually order that a feeding tube be placed, we speech therapy professionals are often the ones to recommend one in the first place. So if you notice any of the above issues, chat with the team sooner rather than later. Your team members include the patient's primary care provider, their neurologists, gastroenterologists, dietitians, infusion companies, among others. Overall, communication is so important around the topic of feeding tubes. You'll discuss with the team members, and of course, you'll discuss with the patient, their family, and care partners. The goal of these discussions is to provide education on the purpose of feeding tubes, usually to supply the primary means of nutrition and hydration in a safe way. You'll also provide general education on how feeding tubes work, what a typical feeding schedule will look like, and whether eating by mouth for enjoyment or recreation is a safe option for them. And another goal of these discussions is to hear about the patient, their goals, what matters to them, what worries they may have, what questions they have. It's often a time we provide emotional support. It's a big thing to hear you're not going to be able to eat your meals anymore. We can practice active listening and reflect back what they say. Many of our patients who have ALS and require a feeding tube will continue to have a high quality of life. The more we can communicate, both by sharing and by listening to our patients, often the better we can support our patients. For more guidance on ALS and dysphagia, visit adultspeechtherapy.co.